Wildfire smoke. It can give beautiful sunsets, but it's deadly. What every senior needs to know. Every summer, people get sick and some die from a situation we see happening more often, and it's all around us, all across North America and Europe. We look outside and the sky looks hazy, or at times almost like nighttime, almost dark, or the sun appears like a bright orange dot in the distance. The air smells like smoke even though there isn't a fire close by. The smoke and danger could be coming from fires that are over 1,000 miles away. The haze caused by the wildfire smoke affects people of all ages, but it can especially affect us older folks. It can be more than just an inconvenience. It can affect your breathing, your heart, and your overall health, and it can kill you. Or it can at least speed up your death. When working as a paramedic, and I did that for over 25 years, I responded to many emergencies involving older adults who were struggling to breathe or became worse during periods of poor air quality. While we can't stop wildland fires, they will happen, and they are happening more often now. But we can take steps to protect ourselves from this harmful smoke. Why are wildfires so harmful? When trees, grass, and buildings burn, they release thousands of chemicals into the air. Along with the smoke are tiny particles called fine particulate matter, also called PM 2.5. They are small, real small. 2.5 micrometers are roughly 30 times smaller than the width of a human hair, and is found in airborne pollution, the smoke and the dust from the fires. So where does this PM 2.5 come from? Well, combustion. Exhaust from burning gasoline or diesel. It comes from industry, power plants, factories, even construction dust. And it comes from the smoke from the wildfires. What are the health effects? Well, these particles bypass your body filters in your air passages, and they travel deep into your lungs. And these particles are so small they can get into your bloodstream. Illness. Well, long-term exposure triggers asthma, heart disease, and lung problems. This is why wildfire smoke isn't just a breathing problem, it can affect your whole body. Why are older adults more vulnerable? Well, as we age, our bodies become less able to handle environmental stress. Many older adults have conditions such as asthma, chronic bronchitis, heart disease, high blood pressure, or diabetes. You don't see that as often in 20-year-olds, but as you get older, you're more likely to have these. Of course, asthma is a concern for young people, and it can be from mild to severe. And also COPD, chronic obstructive pulmonary disease. I've been diagnosed with a borderline case for years. I still was able to climb 21,000-foot peaks in Nepal, though, but during the 80s and 90s, when I was a firefighter, we didn't take wearing our air packs as seriously as we do now. And through long-term exposure to all these chemicals, I'm borderline. So I'm very, very careful now on my exposure to smoke. If you are exposed to smoke, here are some of the signs and symptoms to watch for. One is pay attention how you're feeling. If you're feeling bad, well, that might be a sign. Other symptoms and signs include coughing, and maybe just a slight cough, a sore throat, which is just a tickle in the throat, or it could be more serious. Burning or watery eyes, shortness of breath, wheezing, and tightness in the chest. Headaches, feeling unusually tired, and for some people, smoke can also increase the risk of heart and other problems. You can't always judge the quality of the air just by looking outside. One of the big mistakes people make is assuming the air is safe because they can't smell smoke. Sense of smell can vary from person to person. I lost my sense of smell years ago, and now it's very, very reduced. So you could have smoke in the air and not be able to smell it. So instead of guessing, check the air quality index, often called the AQI. The AQI tells you how clean or unhealthy the air is. The higher the number, the greater the health risk. I use this program right here. So here's a few ideas you can use to help keep your home safer during these smoky times. If the air quality is unhealthy, try as much as you can to stay indoors. Do your grocery shopping beforehand. Watch the news. They often can predict when the smoke is coming. Check the air quality. Keep your windows and doors closed. Make sure your windows are closed all the way. Seal any openings. And if you have air conditioning, set it to recirculate the indoor air rather than pulling the smoky air in from outside. Consider using an air purifier. Personally, I have one. A portable HEPA air purifier can make a big difference. HEPA stands for High Efficiency Particulate Air. These HEPA filters remove many of the tiny particles found in wildfire smoke. What a lot of people are doing, me being one of them, is I took a 20-inch fan and a high-quality furnace filter, a MERV rating of 14. MERV stands for Minimum Efficiency Reporting Value. Now, if you go on YouTube, you can see many examples where people are demonstrating how to take that 20-inch fan and that furnace filter and make it into a home air purifier. If possible, place one in the room where you spend most of your time, especially your bedroom. If you must go outside, wear the right type of mask. A cloth mask will not protect you from wildfire smoke. Neither will a loose surgical mask. If you must be outdoors for an extended period of time, wear a properly fitted N95 or KN95 mask, which provides much better protection from this fine smoke particles. Even then, limit your time outside whenever possible. Stay hydrated. Smoke can dry out your nose, throat, and lungs, and you may feel like a tickle in the back of your throat. So drink plenty of water throughout the day, unless your doctor has advised you to limit your fluids. Keeping your body hydrated helps your airway stay moist and may reduce irritation. Keep taking your medications. Now, if you have asthma or COPD, continue taking your prescribed medications exactly as directed. This is very important for any breathing problems. And always keep a rescue inhaler nearby. Don't wait until you're struggling to breathe before looking for your inhaler. Check on friends and neighbors. Some older adults live alone. A lot of us do. Others may not realize how poor the air quality has become. So a simple phone call or a text can make a tremendous difference. After the smoke clears, even when the sky looks blue again, take it easy for a day or two if you've been exposed to that heavy smoke. Your lungs need some time for recovering. So final thoughts. While we can't control the weather or prevent every wildfire, we can control how we respond. As a retired paramedic, I've learned that many serious medical emergencies begin with a small or mild symptoms that people hope will just simply go away. Don't take that chance and take care of yourself so you can continue enjoying the years ahead. And until next time, stay safe, stay active, and stay healthy. For more videos on health and safety for us older adults, check out these videos here. And please like and subscribe to the channel and share it with anyone you think can benefit from it.